Please carry on, Anupam.
Okay. Good morning, everyone. Myself, Dr. Anupam Singh. I am going to talk on the impact of the COVID-19 pandemic on my training as a first-year resident in ophthalmology. I am here to talk about my journey as a first-year resident in these hard COVID times. As we all know, at the dusk of the year 2019, COVID-19 emerges as a new threat to the medical fraternity worldwide. And as a frontline worker, we resident felt its impact at its worst. And after being in this pandemic for a long duration of 1.5 years, we all felt burnout and stress. This is the topic of the global concern that how we can restructure the residency program in the view of the threat imposed by the COVID-19 on our medical fraternity. There are many studies done in India as well as the worldwide that how we can change the structure of our residency program and how we can improve with that. Now, starting with my journey, uh, at the dawn of the new decade, in the year of 2020, heralded an inauspicious occasion for the ophthalmologist as the global break of the SARS-CoV-2 virus occurred. In the year 2020, it was marked by the great challenge in the form of the COVID-19 pandemic. And on the 99th day of the nationwide lockdown, and with the burden of the 4 lakh cases, we joined our residency program. But due to the COVID protocol, instead of the orientation, we have been sent to the 14 days of the quarantine. Then, after finishing these 14 days of the quarantine, we were introduced to the branch, the duty cycle, and the responsibilities with the stricter trials protocols. So instead of the physical instruction, the whole ritual was being performed on the Cisco WebEx, which later became our Lord and the Saviors for our academic activities. We then came to know how COVID-19 has crippled the routine activities of the hospital, and the huge number of the patient, which at the time could get overwhelming, was reduced to very low numbers. At the time of the orientation, the teaching on the online platform has become the new normal. So instead of the one-on-one bedside teaching and the rounds and the physical teachings, we were then shifted to be to on the online platform like the WebEx and the Zoom. And after that, we were taught about the COVID-19 protocols, in which the hand hygiene, which becomes the insignificant in the mind of the people from a very long time, which had lost in importance, become extremely important, and social distancing becomes must. But in ophthalmology, how we can cope with the social distancing, how we can go without the examination. Then the sanitization of the every instrument after the use become routine, and it is mandatory to use the mask all the time. Sometimes we have to use even 2 masks in the case of the community services and the camp, even if it is what it was very suffocating. Then we have to use the protective equipment and shields as per the risk level after the trials. And then we have to provide all the equipment that have the chin or head width with the best shield. So after the orientation with the OPD and the OT services, we were introduced to the backbone of the ophthalmology, which is known as the community. The community halls, which were once filled with the patient who don't know about the social distancing and the mask, are now empty and having very few patients. Here we can see that the huge load of the patient in the community halls before the COVID era, and in the second image we can see that how very few patients are there in the community halls. The outreach programs also become the non-functional, and even if planned to go somewhere in the camps, there too we have very few patients, and we have to wear the full PPE kit in the hot and the humid environment. It becomes really cumbersome to work like this in the field, wearing the full kit. And before the COVID-19, at our center, we used to perform around 400 surgeries in a day. But after the outbreak, all the elective surgeries were halted, and emergency services are done only when it was very necessary. All the OT complexes were empty, waiting for the patient, and it became really hard for us to learn, and it really broke our learning curve as a resident. In the meantime, we were introduced to the wet lab. It really worked as a boon for us, and we used to practice on the goat eye, bananas, and the thermocol. It really helped us to shape our skills in the hard times without having the full exposure to the surgery. In this image, we can see that we can do suture on the thermocol, banana. We can use the goat eye, and we can also use the unfit donor cornea for the donor cornea in the wet lab for the practice of the phacoemulsification and the keratoplasty. And in the image G and H, we can see how we can fix the goat eye on the set lamp and use it to practice for the indentation to applanation tonometry. And after that, we moved to the different diagnostic technique. We and then also we try to acquire the new diagnostic technique in the meantime. Then, with the decrease in the number of the cases, the normalcy has returned. And after that, we started to organize camp for the needy people. But in the absence of the proper treatment and care during the COVID times, the our burden have increased in the multiple folds. In the meantime, because the government of India launches the initiative to immunize the frontline workers, and it really help a lot us in restoring the full-fledged OPD and the community services. As we were returning to the normal routine services, the rise of the second wave was imminent, and after the mid-Feb, the number of cases is starting to rise, and then in the month of the March, the second wave arrived. We were again went into the partial lockdown, and the OPD services and surgeries were restricted. And then within a period of the week or two, the total complete lockdown was imposed in our state, forcing us to de-escalate to the emergency services only. That means no OT, no OPD, and no hands-on. It again sent us to the wet lab, where we sharpen our skill more. This time we came prepared, and here in this image we can see that image A is preparing the eye stand plus eyeball stand with the fixation head with or without the goat side, and the image B is the mask to practice eye fixation head. This time in the wet lab we started to practice for the FICU. In image C, in image D, we can see how we can use the instruments which are shown in the image B and C. We also move on the online resources for our academics, and this time we were vigilant, so we started to prepare for the online exam. We started to prepare for the ICU examination as well, and then after that, there was the relaxation in the criteria of lockdown happened, and we resume our services at the half capacity with the fear of the new variants, and all the necessary precautions were taken in these also. Now at the present time, we are at the brink of the third wave, and we must adhere to the COVID protocol strictly for our as well as the patient safety. To summarize, the outbreak of the COVID-19 prolonged our learning curve as an ophthalmologist, and in the absence of the patient in the circle hand-on, one may opt for the online resources for the study as well as the online classes, and we may also shift to the wet lab to hone over our skills. But it only causes a small increment in our skill set. And in this pandemic affect our residency program very badly, and we must think to restructure it for the harder times. Thank you, sir.
So thank you, Dr. Anupam. It was very inspiring to see these valiant efforts to learn despite these testing times. So Divakant sir, any thoughts on that?
Yeah, great. And it was really nice to see how well you have utilized the time and with the wet lab and everything. So how was your experience with the wet lab? Do you think it is of course, we will be having subsequent talks on that, but what was your personal experience with the wet lab?
Sir, in the absence of the proper hands-on, wet labs are very useful. And we used to prepare then after that we used to do the surgeries. And these COVID times, sir, we were not getting proper hands-on. So, sir, it's helped us a lot, sir.
When you resumed your routine surgical cases, your training program, so did you think that the deficiency that was because of the lack of cases, was it in some way covered by the wet lab experience that you had?
Yes, sir, it was covered by a wet lab, but sir, it was not as efficient as the normal cases, sir, or normal hands-on, sir.
Great. Pranesh, any other comments from the panelists?
Hi. So, congratulations, Dr. Anupam, on your excellent presentation.
Thank you,
I wanted to ask you something, like you have attended offline lectures, obviously, before in your MBBS. So,
yes.
What are your opinion about, online versus the offline format? What are the difficulties you face or the advantages thereof?
Ma'am, in offline format, the interaction is very good. The one-on-one interaction were very good, and we were used to concentrate more because the presenter was in front of us, and we were to interact more. But ma'am, it is not much possible in the online form, ma'am. And there are much distraction in the online form, and the screen time is more. And some of us are not used to for that much prolonged screen time, ma'am.
Okay, but some of my residents have felt that the online format is really great because they get to attend it from the comfort of their home, and it's like more informal. So it's sort of a more relaxing an environment. But then yes, your points are valid as well. It's a to each his own kind of a situation, but we have to make most of what we have. So
Yes, ma'am.
once again, congratulations on your excellent presentation.
Thank you, ma'am.
Anupam, do you sleep often during online classes?
Sir, it do happen, sir. We feel tired and we feel bored. And sir, there are too much distractions also. So, sir, that's why, sir, I prefer the offline classes more, sir.
And thank you for that honest answer.
I think even the concept of kind of group learning or peer-to-peer learning together is different in an offline mode. Online, you do tend to lose that. You can't really discuss the way things normally were discussed.
Sir, that human touch work like some magic, sir.